Hello, everyone. Today we are going to go over one of our blood pressure assessments, the resting blood pressure assessment. This is the one you guys are going to learn how to do first because it's arguably the easiest. If you can get resting down, you can definitely get exercising down. So, the purpose of taking someone's blood pressure is to provide a basic indication of their cardiovascular health and fitness by assessing the force exerted on the arterial walls while the heart is contracting and relaxing. So the systolic phase is the contraction of the heart, and the diastolic phase is the relaxation, the filling of the heart. So we're going to look here. I got a picture of my dog in here. I didn't clip her out because she's just too cute. So first you are going to choose a properly sized cuff, making sure that that line on the side of the cuff encompasses 80% of the upper arm, and we're going to see that here in a second. Most people will be the normal size, but there are some people that will require either the child size cuff or the large or extra large cuff. But most people will fit in this medium sized bladder that you guys have. So there will be a line on the bladder that points downward that you're going to put on the brachial artery right there on the antecubital fossa, so the inside of the armpit. You're going to place the cuff about 1 inch above that because you don't want the head of the stethoscope to be underneath the cuff because that's going to cause a lot of noise and outside factors that will make it harder for you guys to hear what's going on. All right, and then here is a little video of what your manometer will look like. When working with a new client, you want to make sure that you inflate the cuff to 200 millimeters of mercury. If you've worked with a client before and you know they're typically 120 over 80, you can just inflate it to about 20 over, so 140. So once you inflate it to 200, you're going to slowly let it release at a rate of 2 to 3 millimeters of mercury. And then your first phase, that sharp thud, is going to be your systolic blood pressure. And then that last thing that you hear where it's just kind of a soft murmur and then it's like a where basically the blood is fully going through the artery again because you've released the tourniquet fully, that is your diastolic blood pressure. And you guys will get plenty of practice with this, so don't worry about it if you are not getting it just from the 3 or 4 minute video. So after you've assessed, you're going to fully deflate the cuff, rest 1 minute, and then retake your client's blood pressure. And if the systolic and diastolic are each within 5 millimeters of mercury from your first measure, let's say you got 120 over 80 the first time, and the second time you got 122 over 82, then you're going to average that, and that's going to be your score. There's no odd numbers in blood pressure. Every tick marks a 2, so unless it's the average of what you did, then it can be odd, but your original number is not going to be odd. So if it was, let's say, 130 over 90, and the first time you had 120 over 80, you're going to scrap that and redo that, which could definitely happen when you guys are first getting comfortable and familiar with blood pressure. So after you've taken your blood pressure, you are going to look at your handy dandy chart, and then you're going to rank yourself either normal, elevated, high blood pressure, stage 1, stage 2, or hypertensive crisis. And remember, in exercise testing, we do not diagnose. It's not your job to do that. You can explain to your client what their blood pressure is, and if you see that it is in any of the categories that you're not comfortable with, then you are going to refer out and say you should probably have this checked out by your doctor, but also keep in mind you're new at this, and white coat syndrome is a thing too, which we will discuss in class. So don't freak out about it. If you're unsure and someone's blood pressure is super high, call somebody else over to double check, especially before you guys really get good at this assessment.